Final look for the 2024 Social Security Cost of Living Adjustments and Medicare cost changes. Back in July, I did a video with an early look at potential Social Security Cost of Living Adjustments as well as Medicare costs for 2024. So how did it turn out? First, a disclaimer. The information in my earlier video was not pulled out of thin air or some random guess that I had. It was simply me reporting on what was already being released from Social Security and Medicare and other reliable sources. Hi, I'm Chris Prang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in numerous other states as well. My goal is simple. It is to help you make a wise and confident decision about all, not some, but all of your Medicare choices. If today is your birthday, then a very happy birthday to you. Madeline Langle said, "The great thing about getting older is that you don't lose all the other ages that you have been." So let's take a look at the 2024 Social Security Cost of Living Adjustment estimate. So by now you should be receiving in the mail your annual statement from Social Security telling you what your new income is going to be from Social Security starting in 2024. So the 2024 Social Security Cost of Living estimate was 3.1%. In reality, it got a little bit better. It was 3.2%. When it comes to Medicare, Part A, the deductible estimate was to go from $1,600 to $1,652. In reality, it was $1,632, the lower the better. The copayment for day 61 to day 90 was to go from $400 to $413. In reality, it was $408. The copayment from day 91 to day 150, which are your lifetime reserve days, that estimate was to go from $800 to $826, and in reality, it was $816. For Medicare Part B, the premium estimate was to go from $164.90 to a range of somewhere between $174.80 and $179.80, and in reality, it turned out to be $174.70. The Part B deductible was to go from $226 to $240, and it is $240 for 2024. Under Medicare Part D, there's a thing called a base premium for the Part D, and that estimate was to go from $32.74 to $34.70, and it is $34.70. Now, you don't need to worry about the Part D base premium. Basically, what it's used for is to calculate the Part D late enrollment penalty. That's all. Then the deductible for Part D was to go from $505 to $545, and it is $545. Then we have what's called the initial coverage limit estimate. It was to go from $4,660 to $5,030, and it did. Then after the initial coverage limit of $5,030, you hit what is called the donut hole, and you pay, in most cases, 25% of the cost of the drugs. And then the catastrophic estimate was at $7,400, and it was estimated to go to $8,000, and it did go to $8,000. And in the catastrophic stage, for now on, there will be no 5% coinsurance costs if you hit catastrophic coverage. So because of this, health plans will be picking up the 5%. Will this lead to increased premiums, higher copayments, and paying deductibles? Possibly. By the way, if you're finding this video helpful, please consider subscribing. It is greatly appreciated. Now let's take a look at the IRMAA. That is the income related monthly adjustment amount when your income is above a certain threshold. Take a look at the chart that I have on the screen. On here you will see in the left column where you file as an individual. The second column is if you file jointly. The third column is the actual adjustment that you incur. And then the fourth column is your new premium. This applies to anybody that as an individual makes over $103,000 per year, or as a couple makes over $206,000 per year. And as you will see, the higher up you go in income, the greater the premium is. So if you max it out, if you are an individual and you make more than $500,000 a year, or as a couple $750,000 a year, then you will incur an income-related monthly adjustment amount of $419.30, and giving you a grand total of $594. That is per person, not per couple. Now let's take a look at the Part D income-related monthly adjustment amount. Yes, you get hit twice for income-related monthly adjustment amounts, one on the Part B and then also on the Part D. So same thing, The left column is for the individual, center column is for beneficiaries that filed jointly, and then the third column is what your total adjustment amount will be. So as you see, we go up. The higher up you go, again, the greater the adjustment, and all the way to the end at $500,000 or $750,000 for a couple, you would pay an additional $81 on your drug plan premium. So do you need help making a wise choice when it comes to all your Medicare options? And do you live in one of the states that I'm licensed in? Then please feel free to reach out to me either by phone or through one of my contact forms on my website. If you live near the Charlottesville, Virginia area within about an hour to an hour and a half and you would like to meet in person, please reach out to me and we could probably work that out. If you found this video helpful, you might like this video about turning 65 soon. Which Medicare supplement is best for you? That's it for today. Please remember to like, subscribe, and share. I'm Chris Brang, the Medicare analyst. Make it a great day.